next speaker will be Dr. Sahil Nagib. He will talk about the diameter and the color of extratruncal lower limb varicose veins. Is it a matter?
It is a great honor for me to be with you today. But before I start, I'd like to thank the organizing committee, Professor Ragab, Professor Kharib, and Professor Nagib. Today I'm going to talk about grade 7 vein diameter. I have no disclosures. The question, when to ablate the grade 7 vein? When it's only dilated, or when I have reflux in grade 7 vein, or with symptomatic varicose veins. In our study, we hypothesized that the grade 7 vein insufficiency would be related to the diameter of the grade 7 vein and with the signs and symptoms of chronic venous insufficiency. When and where will we get the diameters? This is the Mendoza diagram with the 2 points to get the diameters just distal to the pre-terminal valve and in the upper third of the grade 7 vein. Reviewing the literature, going back to the 1999, physiological reflux and venous disorders and diameter change in the proximal lower limb during the Valsalva. And in their study, the diameter changed from Vmax to Vrest from 3.5 to 4.3 millimeters. Another study called venous hemodynamics change after the external banding valvoplasty in treatment of primary varicose veins, and they find that the diameter of the grade 7 vein in the mid-thigh was 6.7 millimeter preoperatively and decreased to reach 4.1 millimeter postoperatively, with a reduction of almost 60%. Going further, 2012, another study that concluded that the grade 7 vein diameter is a poor marker for assessing the effect of varicose veins on the patient quality of life. And it's inappropriate to use the grade 7 vein as a single or sole criteria for determining the medical necessity for the procedures. Going more further and talking about the French Society of Pathology, they concluded in their study that in patients consulting for chronic venous disease in France, more than half of them has diameter less than 6 millimeter, while only 8% has the diameter of 8 or more millimeters. This should be kept in mind. In 2020, another study of clinical and hemodynamic significance of the grade 7 vein diameter in chronic venous insufficiency, and they concluded that almost 82% of their cases with grade 7 vein more than 5 millimeters, completely the opposite. With almost 95% of these patients have grade 7 vein and saphenofemoral junction incompetence. They concluded also that less than 5 millimeter has tendency of lower incidence of being of venous incompetence. So the grade 7 vein was their sole marker. And going forward to 2022, increased grade 7 vein diameter at the level of the knee among patients with varicose veins in tertiary care center, a descriptive cross-sectional study. They concluded that if the diameter of the grade 7 vein is small, then the risk of reflux is small, and vice versa. And they put a cut down of 5.5 millimeter as the grade 7 vein diameter. We conducted our study from 2017 till 2022, over 500 patients. The patient of 5 millimeter diameter or less were about 112 patients with a reflux of more than 0.5 second with C2 to C4 SEEP classification stage. They were ablated by laser with using 1890 joules in each patient, and after 1 year of follow-up we had recurrence in 6 patients. The patient of 5 millimeter diameter and more were classified into 4 categories over 5, over 8, over 10, over 12, with 207 patient, 87 patient, 55 patient, 39 patient, and they were ablated by laser, and we had reflux after 1 year in 2322 patients. So if we get a message from our 500 patient, we will get that only 112 had diameter of 5 millimeters or less, and the rest of the 500 were over the 5 millimeters, and all of them had saphenofemoral junction incompetence. To conclude, Mr. Chairman, dear professors and colleagues, therefore, further to the confirmation of sites and the extent of venous reflux identified initially on the clinical examination, the use of duplex imaging based on the grade saphenous vein diameter data of the present article in patients with primary truncal grade saphenous vein and saphenofemoral junction reflux can be expanded to afford a safe quantification of global venous hemodynamic impairment, obviating the use of further functional tests. Thank you, and see you next year.
Thanks, Dr. Sahil.